Hi, guys. I wanted to address a significant disorder, a disorder that kills silently. It is currently killing someone on a minute-to-minute basis around the country, around the world, and that is severe depression. Severe depression is not just in your head. It's a devastating, often progressive disorder that is fatal. It is highly dangerous. It is probably even more dangerous than heart disease because heart disease in many ways gives you some warning signs, although there are variants. Depression is something that affects the entire community. It affects the person or herself, of course. It can affect their family significantly. It involves their relationships. It drops their ability to work and function. It is not just in your head. It is a physiologic problem linked to abnormalities in the brain, specifically in the prefrontal cortex and the cingulate gyrus. It is a neurological problem. It involves actual circuits and neurons. And it's not just a weak personality. But what's more important is that this is a diagnosis that has not been able to be treated successfully with the standard medications. In fact, if you look at the actual studies, if you look at the research, the randomized control studies done by large centers, both private and by government-controlled and independent researchers, only about 20 to 40% of patients improve with the standard medications. And more often than not, patients go from one medication to the next, to the next, to the next, only to find themselves having side effects or not having clear, robust treatment efficacy. So I wanted to tell you that you do have options. Those who suffer from depression, and it is extremely common, have options. We've discussed this on our channel and through other means before, but this really needs to be emphasized that non-invasive brain stimulation with the use of transcranial magnetic stimulation, or TMS, has been revolutionary in terms of reversing depression, sometimes curing it. What I mean by that is actually reducing the depression down to normal levels, and patients often do not need to be on medications. And we have seen this now over the last several years on a time after time basis. We're even now even more convinced of how efficacious and how tremendous the TMS effect is. Now, exactly how it works, I can go into that in more detail, but this video is not about that. This video is to bring awareness to the fact that transcranial magnetic stimulation and non-invasive brain stimulation strategy is extremely effective. In fact, in sub-studies, it is more than 90% effective, especially with respect to the accelerated treatment. If done properly, if done using MRI navigation, if done using biomarkers such as either functional MRI or EEG biomarkers, you can actually have greater than 90% success. Someone's life can be turned around 180 degrees, not only their life, but their wives, their husbands, their children's, their employers, all the people they associate with. They can also get rid of their medications. We have seen that in 5 days, patient's life is turned around significantly. And this is very real. It is published in research articles time and time again, and we see it at our office on a day-to-day, week-to-week basis. So I encourage you to learn more and make sure that you're getting the proper treatment. Having a TMS machine in a corner of an office run by technicians is not necessarily going to give you that 80 to 90% success rate. Having someone that can arrange the protocol such that it's tailored to the patient's symptoms, that there are objective measures. Here's an image before, here's an image after of your brain's circuits, electrical activity, or functional MRI activity that can show exact changes and the improvements that are realized objectively, not just subjectively on rating scales, is extremely important. Making sure that the patient is followed throughout, not just through the course of their 5-day treatment. How you design a protocol, how you design the intensity, the targeting is extremely important and can have a huge impact. So, I go through a very detailed evaluation through EEG bioevaluation, biomarker evaluation, sometimes with functional MRI, and we follow patients on a day-to-day, minute-to-minute basis, and we make sure that they reach success. I encourage you to learn more, and it's a great time that we live in. You can treat obsessive compulsive disorder, anxiety, ADD, and ADHD if done right.